Hello everyone, welcome to today's session on medication calculation every nurse must know. As nurse, accuracy in medication administration is non-negotiable. A small error can make a big difference in patient safety. So in this video, we will break down drug formulas step by step, simplify IV drip and dosage calculation, and practice with real question and examples. Okay, let's move on. So first of all, we gonna discuss our basic formula for dosage calculation. Okay, we need dose required, we need desired dose, available dose, and quantity. These are the four things that we need in our question. Okay, most of the nurses also remember this as a wig. Okay, what we want by what we have times what's it in. Okay, so for example, if patient order is 500 milligram paracetamol per oral and available is 250 mg tablet. Okay, so when it is saying tablet, it means one tablet. Okay, so what we want now, we want 500 mg and that is our desired dose. What we have available dose 250 mg, and what's it in. Okay, because it's saying just one tab, so we will times it by 1 is equal to 2 tab. That's our correct answer. Okay, so this is very basic formula. Let's move to next one. So IV flow rate formula, where we need to find out ml per hour. Okay, to find out ml per hour, we need two things. We need total volume in ml and we need time in hours. Okay, so for example, if order given is 1000 ml normal saline over 8 hour, we have total volume in ml, that is 1000, and then we have times in hour, 8 hours. Okay, when we divide 1000 by 8, it will give us 125 ml per hour as a answer. Let's move to next one. IV drip rate, where we need to find drip rate. So GTT per minute is drip rate. We need volume in ml. Then we need drop factor. So drop factor is the factor that determines how many drops are passing through tube in 1 minute. Okay, and in this formula we need times in minute. Okay, let's do an example. Order is 500 ml normal saline over 4 hours. Okay, so we got volume, we got 500 volume by divided by 4 hours. Okay, and times it by drop factor, and drop factor is 20 GTT 20. So now our order is in hours, so we need to convert it in minute, so we will time it by 60. Okay, so it will be 500 by 240 times 20, and that will be 41.6, that is round off to 42 drops per minute. Everyone happy? Let's move to next one. In this formula we are gonna find out infusion rate. Okay, to find out infusion rate, in hours, you need volume in ml, and then you need rate, at what rate fluid is going through. Okay, so if order is 750 ml of dextrose 5% in water at 125 ml per hour, how many hours is gonna take? Okay, so what we will need, we need volume first, and volume is 750 ml, and then we need a rate, at what rate it is going through, it is 125 ml per hour. Okay, so when we divide 750 by 125, we will get the answer 6 hour. So this is very important, to find out how long it's gonna take. Next one is infusion of units, and this is very important formula because you usually uses for heparin, insulin, dobutamine in emergency ward, in ICU, in critical care. So it is very important, so always remember this one. Okay, to find out ml per hour of infusion of unit, first of all you need to find out how many units are ordered. Okay, how many units are ordered per hour. Okay, then how much volume is in the bag. Alrighty, and then it will be how many total units are in the bag. Okay, that's what we need. Okay, so let's do the example. If we have heparin order, and that is 1000 units per hour, that's our order. Okay, and then we have the IV bag. What is available to us? We have availability of 25,000 units in 250 ml of bag, but we need only 1000 units per hour. Okay, so to do that, we will get the units order per hour, and that is 1000. Okay, and times it by volume in ml. Okay, volume, we will get the total volume of the bag, that is 250 ml, and then how many total units are in the bag, 25,000. Okay, when we will times 1000 by 250 and divide by 25,000, we will get 10 ml per water. When we will administer 10 ml per water to the patient will get 1000 units per hour. Okay, let's move to next one. Concentration formula. This is very important to find the concentration, because some of the medication doesn't come in liquid form, they come into the powder form. Okay, so we need to find out the concentration. To find the concentration, you need drug in milligram. Okay, you need drug in milligram, and then solution in ml. Okay, just for example, 1 gram of vancomycin powder we need to reconstitute with 20 ml of water. Okay, and then we need to find out how strong the output drug will be. So we will divide 1000 mg, that is 1 gram. 1 gram is equal to 1000 mg. Okay, because we are gonna find concentration mg per ml. Okay, we will divide it by 20 ml of solution in which we are reconstituting it. So it will give us correct value of strength, that is every ml of solution contain 50 mg of vancomycin. So this is also very important formula you guys need to remember. Okay, let's move to next one, weight based dosage. So some of the patient does require medication according to their weight. Okay, so in this one you need two things, mg per kg, that will be the ordered. This is ordered, okay, what doctor have prescribed, and then this will be the weight of patient, always in kg. Okay, yeah, just for example, if order is ceftriaxone 50 mg per kg IV once daily, so we need this much dose of ceftriaxone, okay, and patient weight is 22 kg. So then what we will do to find out how much total dose patient need, we will times order 50 mg per kg by patient weight. So 50 times by 22 will give us 1100 mg of medication. So the patient need 1100 mg medication once daily, okay, or OD. Yeah, everyone happy? Let's move to next one, safe dosage range. So this is very important when we need to find out how much medicine we can give to patient. Okay, so then we need to find out like how much total medication we can give patient in a day. So to do that you need mg per kg per day, and then how much patient weight. Okay, so suppose drug safe range is 10 to 20 mg per kg per day. Okay, 10 to 20 mg per kg per day. So this is the level. Okay, minimum we can give 10 mg per kg per day, and maximum we can give 20 mg per kg per day, and patient weight is 30 kg. So to find out the lowest end, we will times 10 by 30. Okay, and that will give us 300 mg per day. And then to find the higher end, we will times 20 mg, because that is the maximum safe range. 20 times 30, and that will give us 600 mg per day. So now we know the patient can have medication between 300 mg to 600 mg per day. Okay, let's move to next one. So this is the critical care calculation, mcg per kg per minute. Okay, and it is very important. It is very important, guys. You really need to remember this one. To find out the ml per hour in critical care, you need the ordered dose. Okay, so this is the dose that is ordered by doctor, and then this is patient weight, okay, times 60, because we want it in hour. Okay, so 60 minutes, 1 hour is equal to 60 minutes, and then volume, that is available. Okay, available volume of the bag, and then drug strength, that is what we got right now available, what we have available. Okay, so example, patient has been prescribed dobutamine 5 mcg per kg per minute. Okay, so we got our required dose, that is 5 mcg per kg per minute. Okay, and then patient weight is 70 kg. Okay, so this is 70 kg. Alrighty, then we have 60. Then we have 60 minutes because we want answer in hour per hour. Okay, and then total available bag. What we have available is 200 milligram in 250 ml. So what we will do, 250. So if we know 1 mg is equal to 1000 mcg, 1 mg is equal to 1000 mcg, and because our order is in mcg, we will convert 250 mg into mcg. Okay, so it will be 250000. Yeah, then we will times it everything. We will put the equation 5 times 70 times 60 times 250 divided by 250000, and that will give us answer 21 ml per hour. Okay, if you guys have any concern, please write in the comments, and then I will explain in the comments. Okay, thank you everyone for joining us today, and stay tuned for more videos, and we do live on YouTube and TikTok, so join Nursingy. Thank you.